healthcare spending per person in the United States is more than double what it is in most other high-income countries. Why is this? Researchers usually come to the same conclusion. It's not that we use more healthcare in the United States, it's that we pay more for it. That is, the price of care is higher. What do we mean by the price? The price for a healthcare service, such as an MRI or an office visit, is the total amount healthcare providers receive for providing the service. This includes what is paid to them by the patient's insurer and what is paid by the patient themselves, in the form of a copay, coinsurance, or deductible. The price that a provider is paid can be very different depending on what kind of insurance the patient has. For example, for patients covered by Medicare, Medicare sets prices based on what it estimates it should cost an efficient provider to deliver that service. But for patients with private insurance, prices are determined very differently. Each health insurer negotiates the price separately with each provider, and the price often depends on who has more leverage. This negotiation system gives an advantage to providers that the insurer can't live without, such as large hospital systems or physicians with rare specialties, which can lead to high prices. It also puts hospitals serving a high proportion of publicly insured patients at a disadvantage, because they lack the negotiating leverage of hospitals that mostly serve privately insured patients. Knowing the cause of high prices, the HPC next wanted to understand how high is too high, and how much of our healthcare spending is due to unreasonably high prices. To answer these questions, HPC researchers started with how much Medicare would have paid for a service, because the Medicare price is approximately what it should cost to provide the care. Then the Medicare price was doubled, and excessive spending was defined as only the portion of spending beyond double what Medicare would have paid. This is a very conservative definition. If it costs an efficient care provider about $1,000 to provide the service, then a price of double what Medicare would pay implies the provider is earning a profit margin of 100%, and only the additional $500 was considered excessive. Inpatient hospital stays are an example of care that can have excessive pricing. The HPC found that 1/3 of inpatient hospital stays were paid more than double what Medicare would have paid for the same care. Lab services, such as blood tests, are another example. Not only do lab services often have excessive pricing, but their pricing also varies depending on where the service takes place. The HPC explored lab services provided at doctors' offices, hospitals' outpatient departments, and independent standalone labs, and found that while more than half of lab services in 2021 did not have excessive pricing, 39% did, almost 3/4 of which were provided at hospital outpatient departments. For this study, the HPC examined excessive pricing for 7 categories of care. These categories of care represent nearly half of all healthcare spending that makes up an average health insurance premium, which was more than $22,000 annually for Massachusetts families in 2021. The HPC found that in 2021, 27% of spending on all of these categories of care combined was excessive due to high prices. This amounts to $3 billion of excessive spending in total in Massachusetts in 2021, which translates to $3,000 per family each year for families who have health insurance through their employers. In this way, high healthcare prices are burdensome for Massachusetts families, especially those with lower incomes. Instead of adding to healthcare providers' bottom lines, that money could be added back into families' budgets, where it could go a long way to meet other basic needs like housing, food, transportation, and childcare.